All right. Can you hear me? Good morning. Can you hear me?
Good morning. Yes, doctor.
All right. Very good. So we shall start now. Last meeting, we were able to complete to discuss completely social development and at the same time perceptual development. I believe no, we're done with this. All right. Yeah. So this I recall, we were able to finish last 15th of September. Now we'll continue. The next area of development for children will be on gender role. No, this is very important in a way that it will help the children to identify their gender and their sexuality, their orientations. No, gender roles are a set of expectations about appropriate activities for male and female. Of course, the important people that will influence the development of children would be their parents and immediate family members of the child. Now, research has shown that even preschoolers believe that males and females have different characteristics. During this time, children would be able to identify whether they are actually leaning towards malehood and femalehood. Now, you will be asking, what about the development of the third gender? Now we call it the third gender. It is very popular in the United States and other countries, no, where LGBT is recognized. And in fact, there is an emerging psychology pertaining to that, the LGBT. You see, since parents and other relatives, immediate family members are very important in the development of gender of the child, so they would always attribute this development in relationship of parents to the child. Like for instance, if you're going to deal with your children expecting that they are male or female, contrary to their actual or biological gender, then there will be a problem. Let's say parents would be expecting a female child, and they were actually thinking and prepared to take care of a female child. Then all of a sudden, the baby that was delivered would actually be male. So what would you expect? You see, all the preparations were done. So eventually, using the principles of nurture, as we discussed earlier, the gender orientation of the child will actually be changed. So the male would actually prefer, because of the influence of the parents and other relatives, would actually prefer some sort of activities belonging to the female, and so on and so forth. So instead of the normal, let's say, preference of color, like male would usually prefer dark colors like blue, they would prefer pink, and so on and so forth. So this is actually very important. You should take note of that, because if you're going to raise your children, make it sure that you are going to raise according to their physical and biological gender, because they can easily be influenced. So therefore, there is a truthfulness on the nurture nature controversy. Moving forward, um, let's proceed now with cognitive development. Anyway, any question about gender role development? Now, you must have to be sure that children must actually meet accordingly in accordance with the biological gender that they are born with. So that should be expected from parents. Do not play around with the gender of the child, because there are parents who are like that. Sometimes we keep on joking the children on their sexuality, then eventually they may lean on towards that particular joke. So you may influence the development of that particular child to other gender, the leaning of that particular child to other gender. So we have to be very careful about that. Okay. Let's move forward to a very important aspects of human development. Well, let's start with the heavyweight here, John Piaget. He is attributed on cognitive development. No, he was the first to give some sort of stages to be followed. No, in terms of human development, particularly in terms of balance and psychomotor actions. No, so cognitive development, according to John Piaget. In fact, John Piaget is a writer who developed this theory, and according to his theory, there are several stages of human development. No, these are the following: stage one, pertaining to sensory motor stage, that is from 0 to 18 months. All right. Now, it may extend up to 2 years. So the next stage would be pre-operational stage, that is starting from either 18 months or 2 years to 7 years of age. Okay. The third stage is the concrete operation. This is from 7 to 12 years of age. And lastly, the formal operations, this will be 12 years onward. So let's try to understand one by one. In terms of sensory motor stage, this is from 0 to 18 months or 0 to 24 months. So expect the child won't be knowing so much, and their balance is actually they are still trying to maintain and learning how to balance themselves. No, and then of course in terms of their thinking, children think as a result of coordination of sensory input and motor responses. The basis of their cognitive abilities would be based on the sensory input and at the same time motor responses. Now, here, intelligence that can be observed from children would always be nonverbal or non-symbolic because the child has not developed language yet. They cannot communicate to you. They cannot speak. They just would like to follow. They just would like to display their sense of balance, their sense of coordination. You see, they will be learning everything through motor responses. Everything, no? So that's the reason why when you're going to raise children, hope you would like them to be very intelligent, to be well developed in the end. You have to make it sure that you stimulate the senses of these children. Maybe you can actually give bright colors. Maybe you're going to give some toys that could actually be manipulated by children. You would actually support their sense of balance. That's the reason why it's very important that children will be placed on a pen. You know, you're familiar with that, right? This is a simple corral wherein the child would actually play around so that they could actually play with toys, interact with toys, stand when they can using the support coming from the corral and so on and so forth. So this is very important. That is one way. You have to support their motor development. You have to support their sense of balance. Children learn by touching. Children learn by looking at things. Children learn by using their senses. That's one. So later on, they try to develop some sort of symbolic activities that would be improved on the next stage, which we call pre-operational stage, where children can now symbolize or mentally represent the word. Before nothing, like in tabula rasa, you see, in sensory stage, they are just acquiring and acquiring and acquiring so many information coming from the environment using their different senses. They react using their motor reflexes, okay, in sensory stage. Now, in the next stage, they try to reason out, they try to utilize their prior learning to create symbols. The children can now think using symbols to mentally represent the world. They try to little by little understand the world around them. Take note of this. This is starting from um, 18 months to 2 years. That's 24 months. So during this time, the child can already walk. You see, as I mentioned to you earlier, a child is expected to walk at the age of 1.5 years to 2 years. So they know already how to balance. No, that's how quickly children would learn. Now, moving forward in pre-operational stage, this period is dominated by rapid development of language. It's very important. They try to symbolize things, they try to think, they try to learn the language that you teach them the language that you should teach. Like for instance, if you would like them to speak English, speak English. So this time, little by little, they quickly understand, they quickly pick up the vocabularies coming from your language, the language that you speak with them. On first stage, they don't care about it. On second stage, they care about symbolism. They care about understanding things. They care about representation of things that they see around them. They care about language. So they really would like to understand the world around them. They attempt to communicate with you also. So it's very important in pre-operational stage. Now, this is actually before going to school. No, moving forward, the next stage is the concrete operation stage. This is a school age wherein children learn mathematical operations because they know how to reason. You see their development from motor. They learn, number one, they learn everything using the senses and react using their motor reflexes. So they really would like to go on sense and balance. Number two, that is pre-operational stage. They would like to understand the world around them using symbols. And number three, they use these symbols to reason out. They will understand mathematical operations already. You teach them mathematics, no? They have difficulty though dealing with hypothetical problems because everything must always be taught concretely. You do not actually teach them how to judge. You do not teach them how to reason hypothetical questions like what do you think about this? What do you think about that? They like concrete knowledge. They would like to learn concrete facts. Like for instance, 1 plus 1 equals 2. It's concrete. You cannot debate about it. You do not actually ask or teach them that when they're going to reason out. Like for instance, son, daughter, what will you do if you found this and that? During this stage, it's impossible that you're going to teach them. It's possible to teach them using concrete knowledge, concrete evidence, concrete facts. Now, they hate hypothetical problems and they hate giving hypothetical questions. They would like to learn using exact explanation, exact or factual things, or concrete facts, events, or objects. In number three, in number four, this time they are going to focus more on hypothetical questions, reasoning. It's called formal operations. No, this stage is where children can handle hypothetical problems already. Number three, no hypothetical problems. That's the reason why we call it concrete operations. 1 plus 1 equals 2, 2 plus 2 equals 4. Do not ask them why 2 plus 2 equals 4. They may not know. What they know only is that 1 plus 1 equals 2. See, they memorize. They tend to look around them. They will point out red is red, black is black. Not hypothetical questions. They cannot answer that. In number four, you can ask them hypothetical questions. This is where you're going to teach students how to how to reason out. Okay, scientific reasoning is also possible. No, the formal thinker is capable of understanding and appreciating symbolic abstractions. Like for instance, in algebra, this time you can teach them different theorems, like the Pythagorean theorem, c squared equals e squared minus b squared, or any formula, e equals mc squared. You could actually teach them that way already so that they will understand. They also are capable of reading literature. They learn how to criticize if the literature that they're reading is good or not. And at the same time, they appreciate different symbolism, metaphors, similes in literature. You see, they would try to understand the language of literature, the language of poetry, They learn to make abstraction about everything because they're capable of reasoning. So during this time, you have to teach them how to reason. You are going to teach them how to make, let's say, how to make some sort of abstract thinking. Okay, you can actually teach them to do ethical judgment. So that's how important it is. So let's try to repeat. J, number one, sensory stage. The focus of attention actually is, or the focus on the acquisition of knowledge will be senses. The responses would actually be focused on motor. So the main focus of the child will be on achievement of the sense of balance, the sense of coordination, so that they could actually move around. The next one, of course, is that we call it pre-operational stage. The focus will be on development of symbols, where the child can easily learn language. You teach them the language, so that means to say, 2 years of age, they can easily grasp language. No, during this time, they could utter already so many words in your own language, the language that you prefer them to learn. The next one, of course, concrete operation. They cannot answer abstract or hypothetical questions. They can answer specific questions. They have difficulty reasoning. They are operating only on concrete examples, like for instance in mathematics, just like what I mentioned to you, 1 plus 1 equals 2. And number four, formal operations, the child will learn already how to make judgment, how to interpret hypothetical problems, how to answer ethical issues. In that case, they can also appreciate literature, the language of literature, and so on. Okay? So, any question about Jan Today? Number four, that's major psychology, okay? Jan Today. Now, we have another major psychology. Actually, we owe so much from him. Sigmund Freud, the psychosexual development, or the psychosexual theory of development. No, there are actually 5 stages accordingly: oral, anal, phallic, latency, and genital. Okay, so oral, anal, phallic, latency, and genital. All right, 5 stages. And according to Sigmund Freud, it's very crucial that we have to remember this. The development of the child is stopped or fully developed at the age of 7. So that means to say 0 to 7 is very crucial. So we have to look on the 7 years of development. Before that, it's very important, it's very crucial. After 7 years, it's already definite. Sometimes a person may never change. That is the contention of Sigmund Freud. So if you're going to look on the first stage, as I mentioned earlier, oral stage, no? From 0 to 1.5 years of age. The focus of attention will actually be coming from the mouth. That's the reason why he called this stage as oral stage. See, the major activity of the child would actually be focused on the satisfaction on the mouth, oral mouth. How do you satisfy that? Feeding. When the child is hungry, they cry. They have also some activities like teething, biting, thumb sucking. Of course, the other thing that we can do is that we have to stop them from drinking milk too much. No, we have to winning. No, the mouth and the breast are the center of all the experiences of the child. So therefore, feeding, giving comfort to the child will be the utmost important here in this stage. Now, there will be so many issues that we can actually derive from here. All right, just like what I mentioned to you in our previous discussion. If you are not going to pay particular attention here, just because sometimes we have a heavy day, so what happens is that we sleep early. So when the child actually cries and cries at midnight, it's very difficult. If you're going to experience this, it's very difficult to take care of a child, no? Particularly when they are on this stage, because you are going to wake up at the middle of the night, right? Now, when the child cries at the middle of the night and you are sleeping and you do not actually recognize to satisfy the needs of the child, if this will continuously happen on that particular stage, what happens is that the child will not satisfy the stage and the child will not move to the next stage. Or there will be an issue that will be the right one here. We call that as fixation. This fixation will lead towards the development of a new problem, which we call anxiety. That we discuss later. Okay? So that's oral stage. So what happens after 7 years of age when the child grows up? When issues have not been solved in oral stage. As I told you, the focus of attention will be mouth. When they grow old, what happens is that they tend to satisfy the things, the experiences that were not satisfied when they were younger. Therefore, when they would be in gathering, they would get lots of food, although they would not eat that. Maybe they smoke, maybe they gossip, you see? They will become selfish. They try to attempt to close down the gap, the hole that was left behind in that particular stage. That is actually be very difficult. It will be very difficult, I'm telling you, no? Oral stage. There's the reason why until now there are people in the society who tend to who not to get along with other people. Greed is there in the society. This is one of the major sins that we have problems that we are encountering. No, in our family there are greedy people. Around us there are greedy people. Our classmates, our friends maybe. They're always telling I. These are the people who could have problems along the way in the oral states of human development, according to Sigmund Freud. So whether you like it or not, you have to sacrifice. That's the reason why when you're going to have children, you have to, well, when you plan to have children, you have to plan for it. Getting married is not easy because getting married is associated with having children, and having children is actually sacrifice. You have to wake up in the middle of the night to change diaper and to feed the child, the baby. You see, it will be very difficult. That's the reason why there are so many issues that would actually have been observed among people who have problems in this stage. This will actually take place from zero, from birth up to 18 months. Moving forward, the next stage will be the anal stage. This is also very important because we have to instill discipline among children, starting from 1 to 3 years of age. So there is overlapping, no? 1 to 3 years. You could actually satisfy the oral stage at the age of 1, and late development would actually be at 18 months. Now, in the adult stage, you could start already toilet training. Now, what is the implication of the toilet training? It's very simple. What does it do? Why is it that we are going to train a child to have this toilet training, to defecate in the designated place? Now, in oral states, they defecate everywhere. You see, we have to assume that, no? They pee everywhere, you know. They would pee on the pants. They would pee on the bed. They would pee on the car seats. That's why they invented the diapers. No, diapers very important in these days. Yeah, but we have to make it sure that when they are wet, we have to change the diaper. No, so a lot of people actually became rich because of diaper. They exploited. You see, even a simple idea can be exploited so that they will become millionaires. No, so they exploited the idea. Therefore, they invented the diaper and they became multi-millionaires. Now, in the anal stage also, toilet training is very important that we are going to train children how to postpone gratification. See, when we are going to teach them the postponement of gratification, in a way, we are instilling discipline to children. That's the reason why adult stage is associated always with toilet training. Toilet training is always associated with human discipline. The discipline that we can see among us. It has a lot of it has a lot to do with poo. That's holding on. That's discipline or letting go. This is actually a pleasure orientation, isn't it? I believe everybody experienced about this. At one way or another, when you are driving along the way, when driving from Dubai to Ras Al Khaimah, I'm so sure there are instances that your pool, maybe your bladder is full. You need to empty the bladder, isn't it? And sometimes, since you are adults already, you are holding on. See, it's discipline coming from adult stage. So eventually, when you found some sort of R&R, rest and recreation, maybe the nearest gasoline station, you would immediately go to the toilet and relieve yourself. That's associated with pleasure, suffering to pleasure. You see, you hold, then you have pleasure after that. That is the meaning of this. So it only tells one thing: you do not defecate everywhere. You have to go to a specific area. That's the reason why, at the age of 1, you may already buy some sort of toilet seat of the child. It could be a very important gift if you have some sort of relatives who are belonging to this age group. No, you start training them. See, they will follow. So at 1 year of age, the child can walk already, early development, isn't it? So you can actually tell them, if you want to poo, I will place this toilet seat here. You come here. You poo here. If you want to poo, you are going to come here. If you want to pee, you come here. You see, why is it that we do not allow them to go to the toilet? Our toilet, the toilet for all people. Why do you think? No, we do not encourage them such. Anybody? No. During this stage, at the age of 1, the child can walk already, so they can be trained. What do you think? Why is it that we do not allow them to go to the toilet that we have at home?
They
In
can't.
any,
They can't reach the toilet seat, and even if they can, they can't manage the situation. Yani they're still young. They need help.
very good. And of course, we are preventing accident to happen, isn't it? No? Sometimes toilet would be wet, isn't it? So children are actually trying to balance themselves, trying to walk. They are still trying to confidently walk during this time. So if the toilet is wet on the floor, there is a tendency that the child would actually encounter accident. For safety, you're very good. That's very good. Also, they can reach. They can reach also. So that's why it's necessary for them to actually have this in their corner, the toilet seat, right? At first, it's very difficult to do because you see, what do we observe? We are doing this all the time wrongly. You know why? If you're going to observe children around, when I go to the mall, I'm always aghast. I'm always surprised. You know why? Because I see 5-year-old child wearing a diaper. You see, when I would go somewhere, a 3-year-old child wearing a diaper. Do you think this is necessary? Have you seen people like that? Even I think even at the age of 6, they are even wearing a diaper. They're even pushing. The card. Are you familiar with this? Have you seen people like that? Maybe some of your relatives. It's a high time for you to correct them. If we are going to do so, what happens that we are tolerating? You see, we are tolerating the indiscipline of children because we are actually telling it's okay to pee anywhere. It's okay to pee as you want. It's okay to poo as you want because they are wearing diapers. So in a way, we are actually tolerating their indiscipline. We are allowing them not to hold, not to postpone the gratification. The main idea in this stage is that we have to train children how to postpone gratification, how to hold themselves. If they are going to do that, if we are going to postpone then we are teaching them discipline. You see? At first, it will be very difficult to do. Imagine 1 year, you are already removing the diapers of children, isn't it? Sometimes along the way, while running, going towards the toilet seat, sometimes they would scatter their pee or their poo. But eventually, little patience. That's the reason why we are teaching them. We have to be patient. See? Sometimes we remove the diapers, then all of a sudden we pee, dirtying our beds, the cover of our beds, the cover of our brand new sofa, the cover of our newly cleaned car. So sometimes it's very difficult. So other people actually, why do we need to gamble? No. So that means to say, when we are actually having, when the child is at home, we wear diaper. It's for convenience of the caregivers, not for the education of children. Take note of that. We are not doing children any good. We are not doing children any good. Yeah? So we have to be a little bit hard to our children in a way. We have to teach them to let go in time, to hold on in time as much as you can. So in that way, they can actually postpone pleasure. In that way, they can actually control themselves. Now, what happens if we will tolerate children to poo and pee everywhere? As mentioned in the theory of Sigmund Freud, what happens is that they are the people, when they grow old, who can easily violate the rules and regulations. These are the people, when you look at them in the school, these are the people who will see always the guidance officer or maybe the principal, because they escape from the class, they jump from the wall of the school, they violate the rules. Just like what we have right now, some among the teenagers. See, they can easily violate traffic rules. They can easily without hesitations, because when they were young, they were allowed to do so. That is actually the implication. Before you know it, you will bring out a child who is a criminal, who is a law violator, who does not care about discipline. You see, we are always looking on the side of the caregiver, like us parents, but not looking on the welfare of the child. We have to be a little bit patient about it. You should know this as nurses to be. You should understand this as nurses to be. Because this could be incorporated in the health education that you will provide to mothers, expectant mothers, or to mothers who have newly born children. You see? Now, the bodily expulsions are the center of the word in this case. This is always associated with holding on, letting go, and the pivot around which early character is actually formed. So, very important Arnel states we are shaping the character of the child. Before you know it, maybe 1 month of training the child, they will do it without you noticing it. They would poo or pee in the designated place. Then little by little, when they can reach the toilet seat at home, you teach them how to be safe. But for the meantime, the little toilet, the toilet that we bought for them, could actually be the place where they exercise this bodily expulsion. This will always be associated with the formation of the personality of the child. And this is actually very important. Look around you. If there are people who are indisciplined, chances are children were let go, children were tolerated during this stage. Parents are parents. Sometimes we would like to be, we think that we are actually giving the best to our children. That's the reason why, no matter what, they must be wearing diaper at home also. Then when you go out, they must be wearing diaper, even though they are already 3 years old, 4 years old, 5 years old, they're wearing diapers. And it's, for me, it's not good to do so, because you're actually telling them it's okay to do so. It's okay not to hold on. It's okay to do as you please. Eventually, when they will grow old, they will develop some sort of licentiousness. They may have low regard of rules. They may have violations of rules and regulations. They will go even against the norms and the morals of the society. That will be a problem. This is very important in any stage. I am always emphasizing this because I'm a school psychologist, I always see students who do have problems. And most of the time, I always discover that there is a problem here, Arnel states, because you see, if you're going to deal with married people, with uh, people whose parents are very busy, children whose parents are very busy, children who are actually very rich. Sometimes they are engaged in allowing children to do things as they please, to do things as they want. If you have, if you have known people like that, they should actually do something better. No, we will not tolerate. We must not tolerate children. We must exercise always prudence in caring for children belonging this stage. We have to exercise our knowledge. We have to let them practice, to hold on, and eventually to let go at the right time. That is very important in this stage.
Doctor, can I share
Yeah,
something?
sure. I appreciate
Yeah.
that.
So I remember before when I was living in another place. So one of my neighbors, she's not my like not she's our neighbor. So she's my mom's friend. She had a son. Until he was 10 years old, she was breastfeeding him.
Mm-hmm.
Yeah, so that's like one of the creepiest thing I've ever seen in my life. Like he's 10 years old and he's still like breastfeeding. So I think this is kind of related to this. Like she's tolerating him. Like for example, no, like the baby will not tell the mother like, please, no, I don't want breastfeeding. No, the mother should, tell him and stuff. So yeah.
Yes, very good. Thank you for bringing this out because in relation to breastfeeding, you see, this must be focused on number one. You understand what I mean? Where the major activity is feeding, and there is what we call as weaning of the child. They need to start also, and They need to start eating solid foods eventually. That is in number one. If they are actually breastfeeding at the age of 10, there is a problem in that case. You see? Because the child may be stuck in oral states. You get the point. One of the major activity in oral states is actually weaning. So at the age of one, the child at least could have stopped, or one and a half, the child could have been weaned already, and they could have started already eating solid foods. They cannot be forever at the age of 10. You're right. You know, it's not good to see a 10-year-old child feed a breast, being, let's say, being breastfed by the mother. It's not good sight also. That's not good thing, no? It is not good for the child. It's not
Yes,
good for
doctor.
the, yeah. Anyone else who do have experience in anal stage or in any of the two stages that we have discussed so far? I would like to stay here because it's very important. I really would like to emphasize this. No, it captures the progress. It captures the development of the child. Because eventually, when we tackle the theories of personality, we would always go back here. The different personality types that we have, we would always go back and associate with the theories of development according to so many psychologists. And in reference, we would always look into Jan Piaget, we would look into Eric Erikson, we would look into Sigmund Freud. See, to explain why is it that the behavior of this particular person is like this and like that. You see, we are lucky if we are going to develop normally, but there are times and there are chances that we are fixated in every specific area of development. So there could be some sort of problems as we grow in terms of our personality development. You see, we look more on into that as we go on. Any question pertaining to anal states? Now, I emphasize this. Now, Arnel stage discipline, toilet training. You have to cut on specific stage. You know when to start. You know when to start. You know when to stop. You know when to cut. Isn't it? I'll give you an example. No, a very basic. What happens if you have delayed? If you are delayed in cutting the umbilical cord of the child, you see, especially right now, home delivery is actually very prevalent. Water delivery is also very prevalent. No, the umbilical cord of the child must be cut immediately. Now, what happens if you are delayed by 1 minute or 2 minutes? Research would also suggest that if you are going to be delayed in cutting the umbilical cord of the child, the immune system of the child may be weak. The immune system of the child may be compromised. That is actually the problem. Delayed for 1 or 2 minutes cutting, that could be the implication, a huge implication. Therefore, in our profession, in nursing, we should know when to start, we should know when to stop. In psychological development, we should know when to start, we should know when to stop. You see, we are holding into our hands the life of our patients. Life. Nurses hold the life of patients. They should know when to start CPR if the patient is actually having some problems breathing, or they are actually having some sort of cardiac arrest. You should know when to start, and you should know when to stop. In psychology, this is imperative. But the problem is, sometimes we do not understand, sometimes we do not know. So therefore, we always resort into a la Karim psychology. You see, you know what I mean? Anything goes. Yeah? So we do not know when to start and when to stop. Like here, right now, if you're going to the mall, I am challenging you. If you go to the mall and you can see children, there are children at the age of 5 actually riding still or being pushed by their parents in the stroller. And at the same time, if you're going to examine closely, these children would be wearing still diapers. Now, eventually, as I will predict, in the future, problem will happen. Remember, we defined psychology earlier, right? Psychology is a science that deals with understanding your human behavior. Now, what is the use of psychology? Number one, interpret, prevent, and predict. You see? Behaviors. Predict. We have to predict. If we see this, if we see them doing this somewhere else in the mall, for instance, we would always say that this child will have trouble in the future. You see? That's the implication of this. Um, I'm telling you, there is no school for becoming a mother. Sometimes we do not know what to do. If we are married, this is the reality of life. We do not go and earn our degree in marriage. We learn by looking at the experience of other people. We learn how to take care of our children by looking or by listening from our parents. What if the concept of the parents would actually be wrong? They pass wrong information. Now you're lucky because you're learning psychology, because at least somehow it will help you to decide better. It will help you to decide for the benefit of the child. You see, small concepts will actually mean a lot in your practice as a nurse. It will mean a lot in your life as mothers or as husbands to be to your children. This is the emphasis. That's the reason why sometimes I'm actually giving so much emphasis here in human development. Okay? Moving forward, Palek states, this is from 3 to 6 years of age. Anybody would tell me what is the root word of phallic? What is the meaning of phallic? Anybody? Hmm. Come on, any guess? Wild guess? Those who are reading Greek mythology, you know, anybody who read the work of Homer,
Is
Iliad
it
and Odyssey? Yeah,
what is the word? Priapic,
phallic.
priapic, something.
No, phallic.
Yeah, but is it like a synonym of it? Is it priapic?
No,
Okay.
it's something like pertaining to genital. No,
Yeah.
priapic. I know what you mean. Yeah,
Yes, exactly.
it's the root word is palus. Are you familiar with that? No. What is palus? Come on, don't be shy.
Phallus?
Palus. No. In Greek mythology, you know, one of the Greek writer, dramatist, created the play. You know, they would actually symbolize, they would love to represent the people in the government, you see. And sometimes if you're going to look at their practices in dramatic scene in Greek, in ancient Greece, no, sometimes they would always try to use masks because you see women were not allowed even to represent. No, that's the reason why men were acting like women, no, actors, and sometimes they would always wear some sort of costumes, no, see. So there is one something like there is a drama, and then this actor would always wear this. No, this is in short. I'm going to tell you now. I am forgive now. I know I do not know if this is actually acceptable to you. This is a male genital. No, that's the reason why we name it as phallic states. Phallic means palus means penis. So what's the implication of this? This stage is always associated with, as I mentioned to you earlier, gender role. So the child would actually heavily identify themselves on what particular gender group that they belong to. They are male or they are female, and they would like to assert into that one. This is belonging to preschool and nursery. No, the focus of attention will be on resolving reproductive issues. There are so many things here. Resolving reproductive issues. Number one, children would have to compare already between male and female. They should know because they would actually be obviously identifying the most obvious among them. Male has this, female has this. In terms of grouping, male must belong to male, female must belong to female. You're out if you do not belong to that gender. Male must play male games, male toys. Females must play with female toys at that particular age. They would be very happy to do that. And of course, there are so many psychological phenomena that's happening here. Like in the case for boys, I really would like to discuss with you about this because Sigmund Freud became controversial on this, no? And in fact, there are so many Greek writings associated with this, no? For boys, there is what we call as Oedipus complex and Electra complex, no? Boys would always think, you see, that's the reason why you're going to observe this, no? I believe 95% of us would always be associated with one of our parents. Like for instance, if you're a girl, you tend towards, you see, your affection would always be majority, 95% of the time would be to your father. In short, you would be close to your father. And if you're a boy, you're leaning toward your mother. You're closer to your mother, isn't it? Am I correct
Doctor,
in
this
that?
doctor,
Yeah. Yes.
This is also applied to the parents, you know, like for example, the mother, she leans more towards her son, and the father, he leans more toward the daughter. It's also applied for the parents, by the way.
Yeah, the feeling and reaction is mutual. You get my point? But actually the originator would actually be coming from children. I believe so. Yeah, right. Ah, yeah. You are closer to your father or your mother?
My dad, yeah.
All right.
Well,
What
I'm the
about
opposite. I'm opposite.
Maria? You're opposite. Okay, you're one
Always
of the
opposite.
exception.
Oh my God. Oh, I feel like, oh my God. Okay.
No, there are exceptions, of course, you know, but 95% of the time it's true, right? And boys would always say, "I'm in love with my mother," and sometimes jealousy. I am going to. They're thinking like, mother, father is my competition. Maybe I will kill dad. No, they're thinking about that. For the girls, I'm in love with dad. No, all right. And therefore, I'm going to do something against mom because mom is my competition. The idea of Oedipus complex and Electra complex, the idea of castration anxiety is there. You see? So you would always, you know, as you grow old, maybe some of you here could actually have some sort of did not pass through this stage. No, it happens. No, you know why is it that Sigmund Freud became controversial because of this? And of course, if you're going to look at this, a lot of people would not agree. But it was immortalized in the story associated with Greek mythology. You see, let's try to look at the story of Oedipus. Are you familiar with Oedipus? That's the reason we have this Oedipus complex, wherein the son would be in love with the mother and the father would be the competition. Electra complex is the opposite. The mother, the child, the girl, the daughter is in love with the father, and the competition is in love with the competition again is the mother. So the mother must always be eliminated. They have to do something like that, you know. So it's some sort of fun because children are always passing through this. In fact, everyone must pass through this, no? Anyway, going back to the story of Oedipus complex in Greek mythology, you see, the, the, there was a kingdom in the ancient Greece. It is a story only. It doesn't mean to say that it's true, no? There was a kingdom in ancient Greece, all right? Uh, the kingdom was brutally ruled by the king, right? And of course, definitely, if the kingdom is brutally ruled by the king, therefore the subjects, that means the people, are oppressed. And when the people are oppressed, that means they are rebelling. They would rebel, you see? So they really would like to see that kingdom of the oppressive king to fall down. What happens that at one point, no, the, there was a newlywed couple. Of course, they got a son. But because of poverty, you see, because of poverty, they could not support the child. So what happened was that the father decided, without the consent of the mother, the father decided to uh, dispose of the son. So what did the son do? What did the father do? The son went to the forest, and just like that, he left the child alone in the forest. He went home, thinking that the child would be eaten by wild animals, by the beast, wild beasts in the forest. So, of course, this father did not know what went on, right? So, you like the story? Hello?
That's a sad story.
Very sad story. I'm going to tell you more about this next meeting, right? I really would like you to look into to read more about Oedipus complex, no? And then so that next time, next meeting, we're going to make a good discussion. This is a very interesting story, no? Sometimes I really would like you to be introduced to Greek mythology also, because most of the time, most of the nomenclatures that we see in psychology would always be associated with Greek mythology. It has nothing to do with this. Anyway, I will end the lesson here. I'll discuss more about the story of Oedipus next meeting. Okay? So let me check. It's already 11:45. I know you're very hungry, you know, and you look so tired, or you appear to be, you seem to be tired already. All right. For your attendance, I will not make a roll call because it will take time. Since this is recorded, I would like you to type present, okay, in the message board. Then you get out already from the portal. Okay, so I will not close yet this portal. Thank you so much. Have a good day.